ever wondered how a CT scan works and why it's so important in medical diagnosis? Well, the process begins with a series of X-ray images taken from various angles around the body. A computer then processes these images to create cross-sectional views or slices of the bones, blood vessels, and soft tissues inside the body. These images offer more detailed information than standard X-rays, making CT scans an invaluable tool in the medical field. CT scans are particularly useful for quickly examining people who may have sustained internal injuries from car accidents or other types of trauma. They can be used to visualize nearly all parts of the body and are crucial in diagnosing diseases or injuries. They also play a vital role in planning medical, surgical, or radiation treatments. Doctors recommend CT scans for various reasons. They may be used to diagnose muscle and bone disorders, pinpoint the location of a tumor, infection, or blood clot, guide procedures like surgery, biopsy, or radiation therapy, detect and monitor diseases such as cancer, heart disease, lung nodules, and liver masses, monitor the effectiveness of certain treatments, and detect internal injuries and internal bleeding. Depending on the part of the body being scanned, you may need to take off some or all clothing and wear a hospital gown, remove metal objects which might interfere with image results, or refrain from eating or drinking for a few hours before the scan. Sometimes, a special dye called contrast material is used to highlight the areas of the body being examined. This dye blocks X-rays and appears white on images, emphasizing blood vessels, intestines, or other structures. It can be administered by mouth, injection, or enema. In some cases, if an infant or toddler is having a CT scan, a sedative may be recommended to keep the child calm and still, as movement can blur the images and lead to inaccurate results. CT scans are performed in a hospital or outpatient facility. They are painless and, with newer machines, only take a few minutes. The whole process typically lasts about 30 minutes. The CT scanner itself is shaped like a large donut standing on its side. Patients lie on a narrow motorized table that slides through the opening into a tunnel. Straps and pillows may be used to help maintain position. While the table moves you into the scanner, detectors and the X-ray tube rotate around you, capturing several images of thin slices of your body. Throughout the process, a technologist in a separate room can see and hear you. Communication with the technologist is possible via intercom. They may ask you to hold your breath at certain points to avoid blurring the images. In summary, Connecticut scans are a critical tool in medical diagnosis and treatment planning. They provide detailed cross-sectional images of the body, which can help identify a wide range of health conditions and guide treatment options. While the process may seem complex, it is typically quick, painless, and highly efficient.